Minister of Health Dr. Frank Anthony in a recent interview disclosed that more than 450 of the 500 samples which were sent to the Caribbean Public Health Agency in Trinidad for testing on August 31 have returned, and the ministry has sent an additional 138 samples which are expected to be returned in a matter of 2 days. The assistance from CARFA was critical in allowing the Ministry of Health to clear a backlog of 1,900 samples taken from persons suspected to have contracted COVID-19 in the past weeks. The contributing factor to the backlog is the fact that only one polymerase chain reaction testing machine is in operation at the National Reference Laboratory, which takes approximately 9 hours to process a set of samples. Clearing of the backlog saw the highest daily case count of 92 new infections being registered on Monday, September 7, followed by 90 on Wednesday, September 9. The National Reference Laboratory currently processes a maximum of 300 samples per day. Minister Anthony noted that should samples pile up again, the option of sending them to the United States of America is being explored.
And we have explored an option if we get back a lot of samples that we are unable to process here in Guyana, that we would be able to send some of those to the United States for processing. And there are two centers that we've been talking with in the United States, one that is based out of Houston and the second one in New York.
In addition, Dr. Anthony highlighted that a meeting would have been held on Friday with Brazilian health officials to discuss the possibility of sending samples from Guyana to the neighboring country.
We have been exploring with the government of Brazil, and in particular the state of Roraima, to be able to send our samples from Region 9 across to Brazil for them to process them for us.
He reminded that the ministry's aim is to ensure that all outlying regions acquire the capacity to conduct testing on the ground. To this end, point-of-care testing equipment are still being pursued.
So when you come to the site, that you can get a test there, and within 15 to 45 minutes, you can get back a result. So you don't even have to wait 24 or 48 hours. Right now, we are exploring the possibility of acquiring a few of those machines and the consumables to go with it. That test can be a little bit expensive and so forth.
The World Health Organization has recommended the use of these new point-of-care immunodiagnostic tests only in research settings. The organization is adamant that they should not be used in any other setting, including clinical decision-making, until evidence supporting use for specific indications is available. PAHO WHO Country Representative Dr. William Adukro has also recommended that only the polymerase chain reaction PCR test should be administered to persons who meet the criteria. The subject minister had 2 weeks ago informed the media that a purchase was made for an automated PCR testing machine, which is yet to arrive. Temika Rodney reporting for the HGP Nightly News.